guys, today I will discuss with you the electrolyte disturbance, and I consider to take hyperkalemia because one of the most important and most common electrolyte disturbance. First of all, we're gonna talk about how much potassium increase to cause hyperkalemia. It's about more than 6.5 millimole per liter, so this is called hyperkalemia. So now you have to worry about the myocardium because the hyperkalemia it will increase myocardial hyper excitability. The hyper excitability when increase it will lead to ventricular fibrillation, and the VF may lead to cardiac arrest. So if it's severe, so you have to control it as soon as possible. This is one thing. The other thing I want to discuss the signs and symptoms. How is your patient will come to you? First of all, you have to take a history. That history about if the patient have any diseases, because the patient may have a renal failure or even he's taking diuretics. So your patient will come after you take a history and do examination with a fast, irregular pulse. He will also come with a chest pain, so you have to exclude what type of pain. Number three, maybe he will come with weakness, and even he will say that he had a palpitation. Now, after the signs and symptoms, you have to look for the cause that do hyperkalemia. Okay, one of the most important causes that we know is the renal failure, especially in the patient who has chronic renal failure. They may be oligouric or even anuric. Number two, the patient may will come with a potassium sparing diuretics. Okay, and number three, patient may come with excessive potassium therapy. He's taking a lot of potassium for massive blood transfusion. Also, this will lead to a hyperkalemia. We have so many other causes, but this is most important to three. Also, maybe we have patient will come with burns and burning. Patient maybe will come with drugs such as anti-converter enzyme inhibitor. This maybe will lead to hyperkalemia. Also, rhabdomyolysis. This is a destruction of smooth muscle, maybe due to infection or even due to trauma. Maybe burns will lead to rhabdomyolysis also. Metabolic acidosis. And the last thing is called artificial result. I mean, with artificial result is the wrong result. That patient doesn't have the signs and symptoms of hyperkalemia, but in the lab result he had hyperkalemia or potassium is high. So you have to consider this. The hemolysis is due to just difficult vein puncture. Maybe is delayed analysis, so this will lead to leak of potassium from the RBCs, and also thrombolysis with thrombocytopenia. The investigation, you need to do a serum electrolyte. Okay, what we will find in the ECG, we will find the next things. First of all, you will find the absent P wave, a wide QRS complex, and hyperacute T wave. Okay, hyperacute T wave. Then, after investigation, you have to do your treatment. Your treatment, it depends if the case is mild or even the case is severe. If the case is mild regarding the signs and symptoms that you had, patient is stable and it is not that high, maybe it's 4 or 5 even, so this is considered as a mild. So you have to give your patient something called calcium resanium. This will help to prevent absorption of potassium from the intestine. You can give it bare mouth. If the patient is vomiting and he cannot take anything orally, try to give it enema by 30 milligrams, followed by calcium colonic irrigation. So this is how you manage the mild cases. In the severe cases, you can give a calcium gluconate, and it's called the rule of 10. you will give a 10 milli of 10% of calcium gluconate over 10 minutes. Or you can give the same formula but calcium chloride. Even you can give 50 milli of 50% dextrose with 10 units of insulin. This is just for prevention of hypoglycemia. So we give insulin just to prevent it. Thank you.